Thank you for the introduction. Once again, I wish I could be there with you in person, but unfortunately, I'm stuck here in cold Canada while you're all in wonderful Abu Dhabi. I would like to start by acknowledging that the land on which I live and work is the traditional unceded territory of the Algonquin Anishinaabe peoples. And here are my disclosures. So today, what I want to give you a brief overview of are types of MARSI, which is medical adhesive-related skin injury, with a focus on skin tears and tension blisters. And these are two topics that are really near and dear to my heart. So let's start with what are adhesives. So adhesives are any material that adheres to a surface or causes adherence between two surfaces. When we look at medical adhesives, these are defined as any product used to approximate wound edges or affix an external device. So it's a tape, a dressing, etc., to the skin. And medical adhesive, as it relates to ostomy care, these are the medical adhesive sprays, the skin barrier pouch, and the tapes, adhesive sprays, hydrocolloids, duct tapes, benzene, seen it all. So it's all adhesives attaching to the skin. So what's the problem with medical adhesives? Well, one is the training on how properly use medical adhesives doesn't get a lot of attention during nursing school or any medical education. 3 in 4 clinicians have said medical adhesives play a critical role in providing high quality care. 69% of clinicians use medical adhesives multiple times a day, but only 38% have reported receiving training on how to use them properly. So what's the impact? Well, 64% of clinicians said injuries caused by medical tape are serious issues. 55% have reported that they've had patients develop skin issues as a result of improper application of or removal of medical tape. So why do we have a problem? Well, first it's attitudes. What else can I do? Skin damage to be expected with adhesives. Adhesive removal hurts. Remove them quickly, get it over with like a Band-Aid. Nothing can be done. Organizations feel that, well, us healthcare professionals just aren't using the products properly. Skin-friendly adhesives are a gimmick to raise the prices. Medical adhesive-related skin injuries are not a prevalent problem. How prevalent is it? Well, to be honest with you, we don't know for sure. In the NICU population, skin injuries, including MARSI, are 31.2%. In the pediatric population, they've been reported as 8% overall. And in a 2003 study, it was 17%. We know that long-term care settings, incidence of skin injuries caused by adhesive tape is around 15.5%. Orthopedic surgeries settings, incidence of tension blisters range from 6 to 41%. And we know that Kiona et al. Reported 15.5 incidents of MARSI among individuals 65 or over living in long-term care settings. So while we don't have a lot of data, we're seeing things emerge to show that this is a problem. So what does it look like? Its skin injury related to medical adhesive is prevalent but under-recognized. Iatrogenic medical complication. Can't speak today. Meaning that this is caused by us as healthcare professionals. We find it across all age settings and all care settings. So let's look at the types of medical adhesive-related skin injuries. And this is based on the work of Lori McNichol and her team. And they did groundbreaking work looking at MARSI, and they coined the term MARSI. So from a mechanical standpoint, we can have skin or epidural stripping, tension blister or injury, and skin tears. We can also have dermatitic reactions such as irritant contact dermatitis or allergic dermatitis, and others such as maceration and folliculitis. So what do we know about MARSI? Well, it results in increased pain, decreased quality of life, increased costs associated with maybe more frequent dressing changes or pouch changes, increased visits to healthcare professionals. So let's look at the different types. So we look at skin or dermal stripping. This is the removal of one or more layers of the stratum cornea occurring following removal of adhesive tape or dressings. Lesions are frequently shallow and irregular in shape, and the skin may appear like it's kind of shiny. Open lesions may be accompanied by erythema and blister formation. So you've all seen that kind of tight, shiny skin. We have a tension blister. This is an injury of separation of the epidermis from the dermis caused by shear force as a result of distension of skin under an unyielding adhesive tape or dressing. Inappropriate strapping of tape or dressing during application, or when a joint or other area of movement is covered with an unyielding tape. When we're thinking about ostomies, we see it when the barrier is put on and then there's swelling, or if this person has a hernia pushing out. We'll often see people take the tape and kind of strap it on so they pull it tight, and this is what can cause the injury. Skin tears, and if anybody knows me, this is something that's near and dear to my heart. A skin tear is a wound caused by shear friction and or blunt force resulting in separation of the skin layers. It can be partial thickness or full thickness. So this happens when we have just that shearing and friction of removing the adhesive that it tears the skin layers apart. So MARSI has been reported to be the third leading cause of skin tears. So a skin tear is a traumatic wound caused by mechanical forces, including removal of adhesives. Severity may vary by depth, not extending through the subcutaneous layer. And it can come in many different shapes and sizes. ISTAT concluded that in order to simplify the classification systems, a consensus should be reached on the definition of a skin flap. So Hannah Van Tiglen et al. Defined a flap as a flap in skin tears is defined as a portion of the skin that is unintentionally separated, either partially or fully from its original place due to shear, friction, and or blunt force. This concept is not to be confused with tissue that is intentionally detached from its place of origin for therapeutic use, such as surgical skin grafting. So this is our skin tear classification system. So now you know what a flat definition of a flap is. So a type 1 skin tear is no skin loss. So it can either be a linear or flap, but they can be repositioned to cover the wound bed. A type 2 is where we have partial flap loss. So the flap cannot be cannot cover the wound bed completely. And a type 3 is when we have total flap loss. So some of the things that we've determined is that we look at the individual factors that can contribute to skin tears, such as chronic or critical disease, aggressive behavior, dependence on others for activities of daily living, history of falls, history of a previous skin tear, skin changes associated with aging, and photo damage. But not all of these individuals will go on to develop a skin tear. It's these mediating factors here in the middle that really play the biggest role. And of those is mechanical skin damage and skin trauma. And this is where medical adhesive related skin injury comes in. If we're not removing or applying adhesives properly, this is where if we have someone with some of these individual factors, they'll go on to develop a skin tear. Now, tension blisters, this is a separation of the epidermis from the dermis, and it's caused by shear force as a result of distension of the skin underlying and under yielding tape or tension, as I said before. So what you can see in this photo is that someone had put a dressing on and they had strapped it on tight. And here we have the wound in the middle is doing quite well, but where the tape was pulling in, that dressing was pulling in from the sides, we had tension blisters develop. The most common cause of tension injury are inappropriate strapping of tape during application and distension of the skin under an unyielding tape. Strapping the tape across the skin is mistakenly thought to increase adhesion. As the tape backing resists stretch or regains its original shape, the epidermis begins to lift. This results in tension blisters, typically seen at the ends of the tape. Skin tears may occur before a blister even forms. Tension injuries may also occur when edema, or hematoma formation or distension distorts the skin surface, or when a joint or other area of movement is covered with an unyielding tape. So we really need to think about how we're applying tapes and how we're removing them. So if we're looking at management, apply the tape without tension, lay it gently, identify patients at risk, so fragile skin, medical conditions, and basically it's the same people who are at risk for skin tears. It's the same problem. Think about surgical procedures where edema or distension is expected, such as abdominal or orthopedic. Protect the skin. If swelling or movement is expected, use a tape that stretches. Apply tape so direction of stretch corresponds with direction of swelling. If desired, compression may be obtained by carefully stretching tape over a dressing while securing the tape to the skin without tension. Now, 3M has put together this great little schematic for us. So we have to think of what's the intended use of the tape. Do we use it more gentle or high adhesion? So depending on what do we need it for, do we need to have really strong? We should always use the lowest level of adhesive we can. What's the wear time? How long are we going to leave it in place for? Knowing that over time, we'll get a peak, right? We start on, we have low adhesion, and then it peaks with the highest after. Normally it's a day or two, we get that peak, and then slowly as our skin naturally starts to shed and go through the regeneration phase, the adhesion will slowly start to loosen over time. So we need to look at how long we need to keep it on for. The anatomical location, do we need skin movement? What other conditions are present? Is the environment dry or damp? Is the patient going to be sweating a lot? We need to look at the right adhesive for the right location. And then we need to consider the patient's risk assessment. So looking at previous skin conditions, allergies, comorbidities, and what is their skin health like? And here's my challenge to you. Ask the question of your patients, what is their skin health? We ask them what their blood pressure is. Do they have cardiac disease? Do they have diabetes? Ask them what their skin health is at the same time. So here's some strategies for preventing MARSI. Educate, engage, ensure, obtain, and conduct. So educate everybody about the importance of picking the lowest level of adhesion for that patient. Engage individuals and their families to advocate. Ensure that everyone in the organization is aware of the added pain and suffering to patients and costs of the healthcare system related to MARSI. Get organizational support for prevention strategies, and know your numbers. Conduct prevalence and incidence studies. So making sure, I'm not going to read all these to you. These are all located in Lori McNichol's article from 2013. But you really want to make sure that you're selecting the proper tape and that you're really making sure that the skin is adequately prepared. So we don't want to remove all the hair. We want to make sure the skin is not soiled, that it's not wet or moist. There's no residue left on the skin. We want to make sure that we have the proper application and proper removal. It's so important that we ensure that when we're applying the tape, that we're gently laying it on. But once again, when we're removing it, we're not just ripping it off. And I'm going to show you a schematic in a second. So we're going to move forward here. And here you can see, this is once again provided graciously by 3M. We can see that we don't pull the tape. We gently lie the tape on. So you can see we've just laid it on. We don't stretch it. And when we're removing the tape, we remove it in the direction of hair growth, and that we don't pull high away from the skin. We want to hold nice and close to the skin and very gently, slowly apply pressure on the skin while we slowly remove the adhesive. And we can also use medical adhesive removers where necessary. So really look to see, do we need to use medical adhesive removers? And remember, slow and steady in the direction of hair growth, and make sure we're not pulling far away. And when we're applying it, we don't stretch, we gently lie it. We want to educate other healthcare professionals, we want to advocate, and we want to conduct regular prevalences. Now, I just want to very quickly end with a study that Dr. Kevin Wu and I did, where we did a pragmatic randomized control clinical trial to evaluate the use of silicone dressings on the treatment of skin tears. And I'll just quickly share the results with you. So what we did was we compared skin soft silicone dressings to traditional non-adherent dressings. And what we found was that, first of all, the silicone dressing, the patients in the silicone or treatment group healed 50% faster. So the wounds healed 50% faster. But by what we mean is that at week 1, almost 50% of the wounds had healed in comparison to 10%. By week 2, 89% of the wounds in the soft silicone group had healed compared to 27.9% in the control group. And at week 3, we had 96.9% of the wounds healed versus 34.4. And what we really liked was the fact that in the control group, we didn't have any new skin tears develop as the result of the adhesives. So it's just something to think about when you're choosing your dressings. We do have these soft silicone dressings that are very gentle on the skin. So just make sure that you're using the lowest level of adhesive you can, and think about using soft silicone dressings when you can. So just quickly, here are my references. And I thank you very much for inviting me to be with you today. And I just want to very quickly come back here. That if you have any questions, please feel free to email me, chair@wocinstitute.ca. Enjoy the rest of your conference, everyone. And thank you so much to the conference organizers again for inviting me to be with you today.